The sleep hormone melatonin is essential for regulating the circadian rhythm and making sure that you fall asleep, but it also can have a variety of functions in mental health, digestion, blood pressure, and more. Melatonin is derived from the amino acid tryptophan and the neurotransmitter serotonin. Melatonin has many important functions in the body, including influencing the circadian rhythm, aiding the immune system, helping eye function, reducing oxidative stress, promoting sleep, controlling many cellular events, including the synthesis of important molecules, and protecting against radiation. The pineal gland, which is nested in the brain, makes melatonin. The quantity of melatonin in the blood depends on the time of day. At night, there's 10 to 15 times more melatonin in the blood than there is in the day, and this helps people sleep. Melatonin is also made by many other organs in the body, especially in the stomach. If sleep is interrupted by blue light exposure at night, the melatonin levels decline drastically. In addition, melatonin levels also decrease with age. However, darkness does not stimulate melatonin production. It simply permits melatonin production. Surprisingly, melatonin has shown promise for reducing pain in endometriosis. In a study of 40 women of reproductive age, 10 milligrams of melatonin per day reduced the pain scores and the dysmenorrhea by almost 40%. Women who took the melatonin also used fewer painkillers. Melatonin plays an important role in the regulation of blood pressure. Activation of its receptors MT1 and MT2 widens the blood vessels, and this decreases blood pressure. Like sleep, blood pressure has circadian rhythmicity. It increases in the morning and decreases at night. Melatonin rises at night and decreases in the morning. This indicates that there may be a connection between melatonin and blood pressure. Certain types of hypertension, high blood pressure, are characterized by low melatonin. In patients with type 2 diabetes, 5 milligrams of melatonin decreased the blood pressure levels. However, there's not enough information about how melatonin reduces the blood pressure to determine whether it's effective at lowering blood pressure. It may be used as a supporting therapy in hypertensive patients. One of melatonin's functions is in the regulation of blood pressure through the circadian rhythm. Some people with high blood pressure may benefit from the melatonin supplementation. Topical gels or creams containing melatonin may prevent sunburn in people with highly sensitive skin. In multiple studies with a total of 83 volunteers, melatonin gels or creams significantly reduced the skin reddening after UV exposure. Thrombocytopenia is a blood disorder characterized by low platelet count. This can result from cancer, cancer treatments, or other underlying conditions. In multiple studies, melatonin restored the platelet count in patients with these conditions or who are undergoing chemotherapy. Tinnitus is an unexplained noise in the ears that affects many people: the elderly, those with a hearing disability, or those affected as a result of certain drugs. Melatonin was 150 times more effective compared with other drugs that treat tinnitus at decreasing the tinnitus symptoms. In elderly patients with tinnitus, melatonin levels are very low. This may indicate that its levels are connected with normal ear activity. Melatonin concentration in the stomach tissue is 10 to 100 times higher than in the blood. Its concentrations are 400 times higher in the gut than in the brain. Stomach melatonin is controlled differently from brain melatonin. Its concentrations are the highest at the middle of the day, not at the night. In the stomach, it reacts mostly to incoming food. Stomach melatonin also controls the behavior of gut bacteria. Melatonin and its precursor, L-tryptophan, can help to heal stomach ulcers in humans. They protect against lesions caused by aspirin and Helicobacter pylori infections. Administration of melatonin also accelerates the healing of ulcers. Melatonin strengthens the intestinal barrier by reducing oxidative stress by up to 88%. It dose-dependently prevented stress-induced stomach damage, and it increased the efficacy of drugs that treat stomach ulcers. Melatonin reduced the free radicals by 88% in rats. Its antioxidant properties can help to stop inflammation in the stomach. These effects can help to protect against disorders like colitis, irritable bowel syndrome, and even various cancers. Melatonin also helps to prevent the death of the stomach lining cells due to poisoning. In one study, starved rats experienced stomach stress. Melatonin treatment for 1 week improved the stomach lining condition. Also, it significantly reduced the stomach pain in IBS patients. Melatonin is secreted by stomach tissues and it appears to play a role in digestion and gut inflammation. Gastroesophageal reflux disease, or GERD, is also known as acid reflux. It's a condition that develops when the stomach acid and its contents come back up the esophagus. Some symptoms include heartburn, nausea, chest pain, and regurgitation. In a study of 36 GERD patients, melatonin supplementation was able to decrease their symptoms. The melatonin reduced the esophageal pressure and it prevented injury when used alone or in conjunction with medication. In humans, melatonin levels decline with age. Oxidative stress and damage contribute to the aging process. Melatonin's antioxidant effects can help to stop the oxidative damage. Melatonin protects against UV-induced skin damage in humans. The topical applications help the skin through melatonin's antioxidant activity. The oral administration does not benefit the skin as much as the topical. In older rats, dietary melatonin helped to stop age-related bone loss. Supplementation increased bone volume and stiffness, which improved the bone health. Melatonin increased the lifespan of various animals, including water fleas, fruit flies, and male rodents. A part of the eye, called the macula, tends to degenerate with age. In a study of 100 patients with macular degeneration, 3 mg of melatonin per day for 6 months maintained vision and tissue status, roughly the same as at the beginning of the study. While there was no measurable improvement in the study, the time frame was long enough that the researchers expect further degeneration should have occurred. Androgenic alopecia is a genetic hair loss condition. Topical application of melatonin helped to prevent the hair loss in men and women with alopecia. Melatonin application improved hair condition and texture. In multiple studies, the melatonin solution helped to partially reduce the hair loss. It also led to new hair growth in some cases. Although its mechanisms are unknown, melatonin could potentially delay hair loss. In one study, the oral administration of melatonin in humans reduced the oxidative damage to the oocytes and it increased fertilization rates. However, since the study was small and did not have a control, this is insufficient evidence. Melatonin may improve the overall movement of sperm cells upon direct exposure. It may also inhibit cell death in the sperm and improve overall sperm quality, therefore increasing the probability of successful fertilization. Aging can lead to a decline in fertility. Melatonin treatment in female mice delayed age-associated infertility. Melatonin administration at 10 mg per kg over 6 to 12 months in mice also increased the quantity and the quality of the egg cells. This may be due to the suppression of oxidative stress by the melatonin. Reactive oxygen species and oxidative damage can negatively impact the success of infertility treatments. Melatonin's antioxidant activity can help with in vitro fertilization results. Melatonin administration can maintain female reproductive capacity in aging mice. However, there's not enough studies on humans to support these results yet. In experimental animals, melatonin activated the brain-derived nootropic factor, a protein that's responsible for nerve cells' well-being and regeneration. Melatonin is being investigated for its potential to strengthen the barrier between the brain and the blood. A leaky blood-brain barrier can cause cognitive dysfunction like brain fog, Alzheimer's, and may also contribute to psychiatric disorders such as anxiety and depression. In mouse models of stroke, melatonin blocked the release of cytochrome C, a substance that would cause cell death if it leaked from the mitochondria. This effectively prevented cell death as a result of the injury. In another rat model of stroke, melatonin blocks the activity of inflammatory cytokine, interleukin-1 beta and TNF-alpha, and cell death proteins BAD and BAX. These proteins initiate inflammation and nerve cell death after the artery leading to the brain gets blocked. Melatonin is being researched in the context of brain trauma. Treatment of rats with melatonin after brain injury helped reduce the subsequent swelling of various brain regions. In amyotrophic lateral sclerosis, or ALS, the nerve cells responsible for movement die. In mouse models, melatonin relieved the symptoms of ALS by preventing the death of those cells and slowing the disease progression. The cells of the eye, especially the retina, make melatonin. Light influences melatonin production. While the cells that react to light produce melatonin, the more light there is, the less melatonin the cells in the eye produces. Disruption of these receptors leads to the death of cone cells, the cells in the eye that help the eye to discern colour. Melatonin is also important for normal eye development. Mice that lacked one of the melatonin receptors, MT1, had a decrease in specific nerve cell crucial for vision. Additionally, it decreases elevated pressure in the eyes in humans. Moreover, the removal of the MT1 in mice resulted in an increase in the pressure inside the eye and death of the nerve cells. The disturbances in melatonin's function may be one of the causes of glaucoma. Melatonin and 5-MCA-NAT, a molecule similar to melatonin, are promising agents for the treatment of glaucoma, which is an eye condition caused by elevated pressure. Melatonin also prevents the death of nerve cells in an experimental model of optic neuritis in rats. Optic neuritis is a disease that causes the death of optic nerve cells responsible for vision. Also, it's beneficial in refractory central serous chorioretinopathy, a condition that affects the eyes of diabetic patients. Animal and cell studies have established a potential role for melatonin in vision and eye health. In patients with type 2 diabetes, the concentration of melatonin both during the day and the night are lower when compared to healthy subjects. However, the effects of melatonin supplements on type 2 diabetes is unclear. Melatonin is part of the internal clock, and it changes insulin levels according to the time of the day. It's very important for insulin balance, as a disruption of this system can cause an inability for the cells to react to insulin and glucose. Even one sleepless night may cause insulin resistance. It can also disrupt metabolism. The disruption of melatonin balance has the ability to cause all of these problems. In rats with diabetes, chronic treatment with melatonin improves diabetes outcome in muscle, liver, and fat tissue. In a cell-based study, melatonin protected the muscle cells from a poison that causes insulin resistance, and it improved glucose transport into the cells. Melatonin also helped to improve the condition of the liver and its activity in diabetic overweight rats. Additionally, it protects insulin-producing cells in the pancreas from cell death. It also restores their function. Drugs that correct melatonin levels can also improve diabetes in rats. Agomelatine, an antidepressant that targets the melatonin receptors, improves chronic pain that's associated with diabetes. This also counteracts depression in patients with diabetes, as well as help to control blood sugar levels. People with type 2 diabetes tend to have lower melatonin levels both during the day and at the night compared to healthy people, and even a single night without sleep can reduce the sensitivity to insulin. As a result, drugs that increase melatonin are being investigated for potential diabetes benefits in early preclinical research. Melatonin also showed protective effects in the heart in animal and cell models. Its antioxidant activity protected against strokes and heart attacks in mice, but very little is known about melatonin and the human cardiovascular system. Melatonin's antioxidant and anti-inflammatory effects may be useful during organ transplantation. It could help to reduce graft failure during heart, bone, liver, and other organ transplants. However, not enough human studies have been done to support these claims. Melatonin supplementation improved some markers of health in prostate and colorectal cancer patients. It reduced the spread of tumours and it increased cancer cell death. Researchers are currently looking into the potential role of melatonin in the prevention and the treatment of various cancers. Breast, prostate, and colorectal cancer patients have been observed to have reduced melatonin levels compared to healthy patients. In cell studies, melatonin has mainly been investigated for its activity against breast cancer. In artificial spheres made from breast cells and cancer cells, adding melatonin blocked cancer-like growth. This was caused when melatonin blocked an estrogen receptor that caused cancer to grow. Melatonin may also stimulate the immune system, in particular Th2 cells and natural killer cells. In mice with stomach cancer, melatonin treatment suppresses the activity of regulatory T cells. The main function of regulatory T cells is to block the activity of other types of immune cells. Tumours support T regulatory cells as they protect the cancer cells from being killed by the immune system. Melatonin blocks the T cells, which can lead to cancer cell death. In cell cultures, melatonin interferes with cancer cells' energy processes. Through this effect, it blocks the cancer cell growth and it limits the ability to invade. Depression and other mood disorders are often coupled with sleep disturbances, requiring agents that have both a sedating and a calming effect. Drugs that activate and bind the MT2 receptors are potential therapeutic agents for such conditions. Abnormal day and night concentrations of melatonin are markers of severe depression. In rats, melatonin alleviates depression induced by chronic stress and significantly changes the brain dynamics of these animals. Melatonin synthesis is also disrupted in patients with bipolar disorder. Melatonin and drugs that target melatonin receptors can be beneficial for bipolar disorder also. As bipolar disorder is also associated with sleep and mood deregulation, melatonin improves the condition in patients with this problem. The most promising results have come in studies on seasonal affective disorder, also called seasonal depression. In 2 studies, melatonin supplements improved both sleep quality and measures of vitality in patients with seasonal affective disorder. Melatonin helps to alleviate symptoms similar to Alzheimer's and Parkinson's disease in mice and rats. The use of synthetic melatonin analogues or melatonin-related molecules to block nitric oxide synthase are being investigated for the treatment of neural diseases ranging from stroke to Alzheimer's and Parkinson's disease. The treatment of elderly patients with Alzheimer's disease with bright light in the morning and melatonin at night improved their sleep and their overall rest. A similar study, carried out for several years in the Netherlands, showed that combined treatments on Alzheimer's disease patients with bright light and melatonin was beneficial both for the rest and the mental health problems. In humans, both the MT1 and the MT2 levels are low in elderly patients with Alzheimer's disease. In mouse nerve cells, melatonin prevents cell death caused by amyloid beta, a substance that causes a condition similar to Alzheimer's disease. The decrease in melatonin activity and synthesis may explain in part the disruption of sleep problems with processing information observed in Alzheimer's patients. Melatonin's antioxidant effects were more efficient than vitamin C in treating the animal model of Alzheimer's disease. It reduced the oxidative stress better than vitamin E also. For more information on melatonin, check out Part 2. For information on herbs, supplements, and natural treatments, check out my website.